Let's study about morphine. Morphine is a opioid analgesic. It is the most important alkaloid of opium. Opium is the dried juice obtained from the capsules of Papaver somniferum. Morphine is the most important alkaloid of opium. Opium is the dried juice obtained from the capsules of Papaver somniferum. Opioid receptors, the three main opioid receptors are mu, kappa, and delta. Mu, kappa, and delta. Mechanism of action: morphine and other opioids produce their action by interacting with various opioid receptors like mu, delta, and kappa. They are located at spinal, supraspinal, and peripheral nerves. Morphine is the prototype drug of opioid analgesics. Let's see the pharmacological actions of morphine. Morphine has mainly CNS depressant effects, depressant effect, but also has stimulant effects at certain sites. The depressant effects of morphine are analgesic effect, euphoria, sedation. Analgesic effect: euphoria, sedation, respiratory depression, cough suppression, and hypothermia. The stimulant effects are meiosis. Pinpoint pupil is the important feature of acute morphine poisoning. Nausea and vomiting, it is a stimulant effect. Vagal center stimulation leading to bradycardia. It also causes physical and physiological drug dependence. Effect on CVS: morphine causes depression of the vasomotor center, causes histamine release, and has direct action on blood vessel. Morphine depresses vasomotor center, causes histamine release, has direct action on the blood vessel. These causes vasodilation leading to hypotension. It causes constipation, urinary retention. It increases intrabiliary pressure by increasing the tone of sphincter of Oddi. It is a histamine liberator that causes itching, skin rashes, urticaria, vasodilation, and bronchoconstriction. So हिस्टामिन के कारण itching, skin rashes, urticaria, vasodilation और bronchoconstriction होता है. ये bronchoconstriction होता है, that's why it is contraindicated in bronchial asthma and COPDs like emphysema, chronic bronchitis. So the mnemonic for morphine is Marfin CVS. Marfin CVS is the mnemonic for the pharmacological action. M for meiosis, A for analgesia, R for respiratory depression, P for physical and psychological dependence, H for histamine release, hypotension, and hypothermia. Itching, N for nausea, vomiting, E for euphoria, C for cough suppression and constipation, V for vagal stimulation which causes bradycardia, S for sedation and hypnosis, M for meiosis, A for analgesia, R for respiratory depression, P for physical and psychological dependence, I for itching, H for histamine release, hypotension, and hypothermia, N for nausea and vomiting, E for euphoria, C for cough suppression and constipation, V for vagal stimulation which causes bradycardia, S for sedation and hypnosis. Yeah. So morphine relieves pain. It is an analgesic. The most important action is to relieve pain. It also relieves fear, anxiety, and apprehensions, which are the reaction to pain. It relieves the sick feeling associated with illness because of euphoriant effect. So morphine relieves pain, fear, anxiety, and apprehension, reaction to pain, and it also relieves the sick feeling associated with illness. फार्माकोकाइनेटिक्स: ओरल एडमिनिस्ट्रेशन पे मॉर्फिन बहुत स्लोली एब्जॉर्ब होता है और इराटिकली एब्जॉर्ब होता है. मॉर्फिन हैज़ अ एक्सटेंसिव फर्स्ट पास मेटाबॉलिज्म, ठीक है, जिसके कारण इसका ओरल बायो अवेलेबिलिटी बहुत पुअर होता है. मॉर्फिन का कॉमन रूट ऑफ एडमिनिस्ट्रेशन होता है IV, IM और सबक्यूटेनियसली. ओरल नहीं होता है बिकॉज इट हैज़ अ वेरी लो ओरल बायो अवेलेबिलिटी. Other routes are oral, epidural, and intrathecal. Most commonly IV, IM, and subcutaneous. Okay, other routes like oral, epidural, and intrathecal. Widely distributed in the body, crosses placental barrier, metabolized in liver by glucuronide conjugation. Widely distributed, crosses placental barrier, conjugated, it undergoes glucuronide conjugation in the liver. Morphine 6 glucuronide has more potent analgesic action than morphine and is excreted in urine. Let's see the adverse effect. So जो mnemonic was Marfin. Marfin CVS. तो इसमें N stands for nausea and vomiting. C stands for constipation. R stands for respiratory depression. H for hypotension which is due to vasodilation. ठीक है, हिस्टामिन रिलीज के कारण वैसोडाइलेशन होता है. मॉर्फिन का डायरेक्ट इफेक्ट भी होता है ब्लड वेसल्स पे. ठीक है, सो इट कॉजेज हाइपोटेंशन. S for sedation, drowsiness, confusion, and mental clouding. I for itching due to histamine release, and it also causes skin rashes. Histamine release के कारण vasodilation, bronchospasm, itching, skin rashes होगा. Difficulty in micturition, constipation होता है, difficulty in micturition होगा. Respiratory depression in newborn due to the administration of morphine to the mother during labor. ये ड्रग टॉलरेंस डेवलप कर सकता है. क्रॉस टॉलरेंस भी होता है. ठीक है, देयर इज क्रॉस टॉलरेंस अमोंग द ओपियोइड्स. सीजर थ्रेशोल्ड लेवल इज लोअर्ड. There is drug dependence which can be physical or psychological. It is the main drawback of opioid therapy, drug dependence. Then we have acute morphine poisoning. The classical triad of acute morphine poisoning are respiratory depression, pinpoint pupil, and coma. Contraindications of morphine: head injury. Morphine is contraindicated in head injury because इसका जो effects है like vomiting, meiosis और mental clouding. This interferes with the assessment of progress in head injury patient. मॉर्फिन के कारण रेस्पिरेटरी डिप्रेशन होता है जिसके कारण CO2 रिटेंशन होगा, सेरेब्रल वासोडाइलेशन होगा. दिस इंक्रीजेस इंट्राक्रेनियल टेंशन. It is contraindicated in head injury because it will interfere with the assessment of the progress, and it also leads to increase in the intracranial tension because of respiratory depression. Morphine causes severe bronchospasm, that's why contraindicated in bronchial asthma. Also avoided in COPD like emphysema, chronic bronchitis, and core pulmonale. Okay, these are the conditions with low respiratory reserved. Hypotensive states में it is contraindicated. It should be cautiously used in shock or when there is reduced blood volume. Hypothyroidism or hypopituitarism, there is prolonged and exaggerated response to morphine. Infants or elderly may it should be not given. They are more prone to respiratory depressant effect of morphine. In elderly men, there is more chances of urinary retention. It should not be given in undiagnosed acute abdominal pain. Morphine, if given before diagnosis, can interfere with the diagnosis by masking the pain. Its spasmogenic effect may even aggravate the pain like biliary colic. So it is contraindicated in head injury as it will interfere with the assessment of progress and also lead to increased intracranial tension because of respiratory depression. Contraindicated in bronchial asthma, COPD, in hypotensive states, hypothyroidism or hypopituitarism में. In infants and elderly, because elderly में it will cause more urinary retention, and infants and elderly are more prone to respiratory depressant effect. It should not be given in undiagnosed acute abdominal pain. Let's see the therapeutic uses of opioids as analgesic. Morphine and other opioids are potent and efficacious analgesics, hence used to moderate and hence used for moderate to severe painful conditions such as acute myocardial infarction, burns, pulmonary embolism, fracture mandible. They are used in acute MI, burn, pulmonary embolism, fracture mandible, and bullet wound के long bone के fracture में they are used. They are used to control severe pain in the terminal stages of cancer. In renal and biliary colic, atropine is used with morphine to counteract the spasmogenic effect of morphine. Opioids are preferred analgesic in severe painful conditions. This is the WHO analgesic ladder. Start with NSAIDs or paracetamol if there is mild to moderate pain. Mild to moderate pain में NSAIDs or paracetamol. If pain is not controlled, a weak opioid like codeine. Plus minus NSAIDs plus minus adjuvant. Adjuvants can be antidepressant, anti-epileptics, anxiolytic, steroids, etc. If pain persists, moderate to severe pain, then use a potent opioid like morphine or methadone plus minus NSAID plus minus adjuvant. Mild to moderate pain है, then give NSAID or paracetamol. Pain control नहीं हो रहा है, then give a weak opioid like codeine. ठीक है, plus minus NSAID plus minus adjuvant. If pain persists, if there is moderate to severe pain, then give a potent opioid like morphine or methadone plus minus NSAID plus minus adjuvant. Adjuvants are can be antidepressants, anti-epileptics, anxiolytic or steroids. Opioids are used as analgesic then as pre-anesthetic medications. Opioids like morphine and pethidine are used about half an hour before anesthesia because of their sedative, analgesic, and euphoric effect. The dose of anesthetic required is reduced. It is used in acute pulmonary edema or cardiac asthma. Acute pulmonary edema या cardiac asthma. IV morphine relieves breathlessness associated with acute left ventricular failure due to pulmonary edema. पल्मोनरी एडिमा के कारण लेफ्ट वेंट्रिकुलर फेलियर होगा, उसके कारण जो ब्रेथलेसनेस होता है, IV will relieve that. IV morphine will relieve the breathlessness associated with acute left ventricular failure caused by pulmonary edema. ठीक है, ये कैसे करता है? तो जो मॉर्फिन है, इट रिड्यूसेस द प्रीलोड ऑन हार्ट बाय पेरिफेरल वैसोडाइलेशन करवाता है, जिसके कारण प्रीलोड कम होगा. शिफ्टिंग ब्लड फ्रॉम द पल्मोनरी टू सिस्टमिक सर्कुलेशन, पल्मोनरी से सिस्टमिक सर्कुलेशन में ब्लड शिफ्ट हो जाएगा. इट रिड्यूसेस एंजाइटी, फियर एंड apprehension associated with the illness. So third uses acute pulmonary edema or cardiac asthma. IV morphine relieves breathlessness associated with acute left ventricular failure due to pulmonary edema by reducing the preload on heart, by causing peripheral vasodilation, shifting the blood from pulmonary to systemic circulation, and reducing anxiety, fear, apprehension associated with illness. It is used in post-anesthetic shivering. Here, pethidine is effective. कफ के लिए कोडिन और डेक्स्ट्रोमेथोर्फेन आर यूज्ड फॉर सप्रेशन ऑफ ड्राई कफ, डायरिया. Synthetic opioids and loperamides are used for symptomatic treatment of diarrhea. तो मॉर्फिन जो है वो मेनली किस चीज़ के लिए यूज़ होता है? एनाल्जेसिया के लिए, मॉडरेट टू सीवियर एनाल्जेसिया. ठीक है, बाकी यूजेस क्या है? प्री एनेस्थेटिक मेडिकेशन में, पोस्ट एनेस्थेटिक शिवरिंग में, अक्यूट पल्मोनरी इडमा और कार्डियक अस्थमा में, कफ और डायरिया में भी. ठीक है, मॉर्फिन जो है इट इज़ अ नेचुरल ओपियम एल्कलॉइड. एनाल्जेसिक डोज इज 10 milligram IM or IV. Morphine is 10 times more potent than pethidine. It produces sedation, euphoria, respiratory depression, and drug dependence. It causes constipation, biliary spasm, urinary retention, and meiosis. It has antitussive effects. It releases histamine. It has rapid onset and longer duration of action. Morphine causes severe respiratory depression in newborn when it is given to mother during labor. So that's it about morphine.